Greetings everyone, you're tuned into the Dr. Nguyen YouTube channel, where health matters are simplified for you. We're on a mission to share critical health insights, answer your pressing questions, and demystify medical jargon. Today, we're turning the spotlight on a common but often overlooked condition, obstructive sleep apnea, or OSA as it's commonly known. We'll explore everything from risk factors to prevention, making it as comprehensible as possible. So buckle up. Stay with us as we delve into the world of obstructive sleep apnea. Unveiling the curtain on OSA, we start with the risk factors. Just like any health condition, certain elements may increase your likelihood of developing obstructive sleep apnea. Firstly, obesity is a significant risk factor. Excess weight can contribute to the narrowing of your airways, leading to disrupted breathing. Age also plays a role. While OSA can affect anyone, it's more common in middle-aged and older adults. But the risks don't stop there. Lifestyle habits such as smoking and alcohol consumption can exacerbate the condition. Smoking can cause inflammation and fluid retention in the upper airway, while alcohol can relax the muscles in your throat, making it easier for your airway to become blocked. Lastly, don't forget about family history. If OSA runs in your family, you might be more susceptible to it. Awareness of these risk factors can be the first step towards preventing OSA. By understanding what may contribute to the condition, you're better equipped to take proactive measures for your health. Moving on, it's crucial to recognize the signs and symptoms of OSA. Obstructive sleep apnea, or OSA, often goes unnoticed until a partner or family member becomes aware of the most recognizable symptom, loud snoring. But remember, not everyone who snores has OSA, so it's important to look for other signs as well. Another key symptom is episodes of stop breathing during sleep. This is often noticed by someone else observing the person while they're asleep. These episodes can last for a few seconds to several minutes and may occur 30 or more times within an hour. Abrupt awakenings accompanied by shortness of breath is a sign that a person may be suffering from OSA. This happens when the person's brain reacts to the lack of oxygen by waking them up to reopen the airway. Morning headaches are another common symptom. These headaches are caused by low oxygen levels and high carbon dioxide levels in the blood, which occur when a person's breathing is interrupted during sleep. Lastly, excessive daytime sleepiness, also known as hypersomnia, is a major sign of OSA. This occurs due to disrupted sleep during the night, leaving the person feeling excessively tired during the day, even after a full night's sleep. Identifying these signs early can help in timely intervention. So, if you or someone you know is experiencing these symptoms, it's important to consult with a healthcare professional. Remember, recognizing the signs is the first step towards managing and treating obstructive sleep apnea. OSA is not to be taken lightly, as it can lead to serious complications. Let's delve into some of these. First up, we have high blood pressure or hypertension. During sleep apnea episodes, the sudden drops in blood oxygen levels increase blood pressure and strain the cardiovascular system. This strain can manifest as heart problems, including the risk of heart attack, stroke, and atrial fibrillation, a fast, irregular heartbeat. Now, let's talk about type 2 diabetes. OSA increases the risk of developing this form of diabetes, and of having it poorly managed if you already have it. It's a vicious cycle. Then there's metabolic syndrome, a collection of conditions including high blood pressure, high cholesterol levels, and an increased waist circumference, all of which are risk factors for heart disease. Lastly, OSA also causes complications with medications and surgery, especially those involving sedation and general anesthesia. Understanding these complications underscores the importance of diagnosing and treating OSA. Now, let's talk about how OSA is diagnosed. The process begins with a thorough physical examination. Doctors typically check the throat, mouth, and nose for extra or large tissues. The neck circumference might also be measured, as people with larger necks are more likely to have OSA. The next step is usually a sleep study, also known as a polysomnogram. This test measures how well you sleep and how your body responds to sleep problems. It monitors your heart, lung and brain activity, breathing patterns, arm and leg movements, and blood oxygen levels while you sleep. In some cases, additional tests might be necessary. For instance, an electrocardiogram, or ECG, might be used to check for heart problems. A thyroid function test could be done if the doctor suspects a thyroid issue. Remember, Early detection is key. Early diagnosis can significantly reduce the risk of complications. Let's keep this conversation going as we delve into treatment options in our next segment. It's time to explore the treatment options for OSA. Imagine a world where the struggle to breathe while sleeping is no longer a nightly battle. This world can be a reality with the right treatment plan for obstructive sleep apnea, or OSA. Firstly, let's talk about lifestyle changes. These can be the initial steps towards managing OSA. Losing weight, quitting smoking, avoiding alcohol and certain medications, and switching to side sleeping can all contribute to reducing the symptoms of OSA. Next, we have mouthpieces. These devices are designed to keep the throat open, providing an unobstructed airway during sleep. They can be custom fitted by a dentist specializing in sleep apnea, and are often a good option for mild to moderate cases of OSA. Then, we have the treatment that often comes to mind when we think of OSA. Breathing devices, specifically continuous positive airway pressure, or CPAP. This device works by delivering a constant flow of air through a mask worn while sleeping. The pressure keeps the airway open, allowing for uninterrupted breathing. However, some people may find wearing a mask uncomfortable. In such cases, there are alternatives like bi-level positive airway pressure, or BiPAP, which varies the air pressure, and adaptive servo-ventilation, or ASV, which stores information about your normal breathing pattern and uses it to normalize your breathing. For severe cases of OSA where other treatments haven't worked, surgery might be an option. This could involve removing excess tissue from the throat, repositioning the jaw, or implanting a nerve stimulator that controls tongue position. It's important to note that the right treatment for OSA depends on a variety of factors, including the severity of your condition, your overall health, and your personal preference. Thus, it is crucial to have a personalized treatment plan crafted with the help of a healthcare professional. Remember, effective treatment can help you breathe easier, sleep better, and enjoy a healthier life. Your nights don't have to be a battle against breathlessness. With the right treatment, you can instead look forward to peaceful, restful sleep. Finally, prevention is always better than cure. When it comes to obstructive sleep apnea, there are several preventive measures you can take to keep this disorder at bay. First and foremost, maintaining a healthy weight is crucial. Excess weight increases the risk of airway obstruction, so keeping a check on your weight can significantly reduce the chances of developing OSA. Avoiding alcohol and sedatives is another effective preventive measure. These substances relax the throat muscles, causing them to collapse and block the airway during sleep. So saying no to these can help you keep OSA at bay. Smoking is another big no. It increases inflammation and fluid retention in the upper airway, which can worsen OSA. Therefore, quitting smoking can significantly reduce the risk of this disorder. Lastly, regular exercise is a great preventive measure. It helps maintain a healthy weight and promotes better sleep habits. Adopting these preventive measures can shield you from the clutches of OSA. To wrap up, let's revisit the key points about OSA. Obstructive sleep apnea, a common yet serious sleep disorder, can be identified by risk factors such as obesity and aging. Symptoms like loud snoring and chronic fatigue are red flags. Complications may include heart problems and type 2 diabetes. Diagnosis typically involves a sleep study, and treatments range from lifestyle changes to medical devices or surgery. Prevention focuses on healthy habits. Remember, health is wealth, and a good night's sleep is an integral part of it. Stay healthy, stay informed. Until next time on the Dr. Ngu Yen YouTube channel.